The paradox of cannabis, when relief turns to illness. Understanding cannabinoid hyperemesis syndrome in a striking medical paradox that challenges conventional wisdom about cannabis. Healthcare professionals across the United States are witnessing an alarming rise in a condition that turns marijuana's well-known anti-nausea properties on their head. Cannabinoid hyperemesis syndrome, CHS, once a rare medical curiosity, has emerged as a significant concern in emergency departments nationwide, paralleling the expanding legalization and increasing potency of cannabis products. The rising tide of an unexpected syndrome as cannabis use becomes more widespread and socially accepted. Medical professionals are grappling with a surge in cases of CHS, a condition characterized by severe episodes of nausea, vomiting, and debilitating abdominal pain in regular cannabis users. This development presents a fascinating contradiction. A substance widely known and used for its anti-nausea properties is, in some cases, becoming the very cause of intense gastrointestinal distress. Understanding the three phases. The progression of CHS typically follows a distinct pattern, unfolding in three phases that can significantly impact a person's quality of life. The initial phase manifests as a gradual onset of nausea, often mild at first but progressively intensifying. This leads to the second, more severe phase characterized by cyclical vomiting episodes that can persist for up to 48 hours, sometimes accompanied by an unusual phenomenon where patients may experience simultaneous screaming and vomiting due to the intensity of their symptoms. The final phase brings relief as symptoms gradually subside, though this respite may be temporary without appropriate intervention. The profile of risk. While medical professionals initially observed CHS primarily in long-term cannabis users, the condition's scope has broadened considerably. Current evidence suggests that CHS can develop in individuals who have used cannabis for as little as 6 months, though it also affects those with decades of use behind them. The syndrome shows no particular preference for age or health status, appearing in both young adults and older individuals, regardless of their overall health condition or presence of other medical issues. The potency factor, a significant factor contributing to the rise in CHS cases, appears to be the dramatic increase in cannabis potency over recent years. Modern cannabis products bear little resemblance to those of previous generations, with THC concentrations showing a marked increase. Scientific analysis has documented this trend, with average THC levels rising from approximately 10% to nearly 14% in just a decade. This increase in potency, combined with greater accessibility and a perception of cannabis as inherently safe due to its legal status, has created perfect conditions for CHS to emerge as a more common medical concern. Diagnostic challenges. One of the most significant challenges in addressing CHS lies in its diagnosis. The symptoms of severe nausea and vomiting are common to numerous medical conditions, making it difficult for healthcare providers to immediately identify CHS as the underlying cause. This diagnostic challenge has led to unfortunate cases where patients have undergone unnecessary medical procedures, including gallbladder removals, before receiving a correct diagnosis. Treatment approaches. The primary and most effective treatment for CHS remains straightforward but often challenging for patients to accept: cessation of cannabis use. However, medical professionals have identified several interventions that can provide relief during acute episodes. These include the administration of specific medications such as haloperidol, droperidol, and various benzodiazepines. Interestingly, some patients find relief through hot showers or the application of capsaicin cream to the abdomen, though these methods address symptoms rather than the underlying cause. The detection dilemma. Modern medicine's ability to diagnose CHS faces another challenge in the form of detection limitations. While traditional urine drug screening can identify cannabis use in many cases, the rise of synthetic cannabis products has complicated this process. Many synthetic variants do not register on standard drug screens, potentially leading to missed or delayed diagnoses. Changing perceptions and public health implications. The emergence of CHS as a significant medical concern challenges popular perceptions about cannabis safety and highlights the need for more nuanced public health messaging. The widespread belief that cannabis is non-addictive and universally safe requires careful reconsideration in light of conditions like CHS. Medical professionals emphasize that while cannabis may indeed be safe for many users, blanket assumptions about its safety can lead to dangerous oversights. The path forward. As our understanding of CHS continues to evolve, several priorities emerge for the medical community and public health officials. The need for increased awareness among both healthcare providers and the public about the potential risks of regular cannabis use, including the possibility of developing CHS. The importance of developing more sophisticated diagnostic tools and protocols to identify CHS quickly and accurately, preventing unnecessary medical procedures and prolonged suffering. The critical role of education in helping cannabis users recognize early symptoms of CHS and understand the importance of seeking appropriate medical care. The necessity of continued research into the underlying mechanisms of CHS to develop more effective treatments and potentially identify preventive measures. Conclusion: as cannabis continues to gain legal status across the country and its use becomes more widespread, understanding conditions like CHS becomes increasingly crucial. This paradoxical syndrome serves as a reminder that even substances with well-documented medical benefits can have unexpected adverse effects in certain circumstances. Moving forward, balanced and informed discussions about both the benefits and potential risks of cannabis use will be essential for public health and medical practice. Only through continued research, improved awareness, and careful monitoring can we hope to better understand and address the challenges presented by CHS while ensuring appropriate care for those affected by this challenging condition.